Lipedema is considered a chronic disease. And what that means is that a person who has lipedema is always going to have to manage these symptoms in one way or another to feel their best. My name is Katie. I'm an occupational therapist and a lymphedema specialist. And in this video, I'm going to teach you some methods on decreasing the symptoms from lipedema. My number one method is to try to decrease the inflammation in our body. One of the biggest ways that we have inflammation is from our diet. So the foods that we eat. Top food categories that cause inflammation are gluten, dairy, sugars, and alcohol. All of those categories increase the inflammation or the swelling in our body. Our bodies just tend not to like those food categories, and in result, if you have lipedema, you have increased symptoms. So trying to decrease those food groups throughout your day-to-day life can help you feel better. This does not have to be a 100% hard rule that you cannot have those food groups. You can, enjoy a night out with friends and family, enjoy your birthday. It's just that we're talking about the majority of your time should be from natural whole foods without sugar, alcohol, gluten, and dairy. And trying to work with maybe friends or family who can kind of keep you, make it easier for you is sometimes helpful, especially if you're married or living with other people. When we all eat the same diet, it's usually a little bit easier than when you're sitting next to someone who is eating pizza and ice cream and all of the things, and then you're eating more natural whole foods. So trying to get a family member on board can help with decreasing those food groups. Number two is to increase your activity. So again, this doesn't have to be a hard rule to where you're going to the gym for an hour a day. This could be as easy as every hour, hour and a half, you get up and you walk, whether that be around your house, around your office. It could be just getting out in your neighborhood, walking around the block. A little bit of activity is going to help the lymphatic system and push that fluid out of your legs and into your body so that your body can reabsorb it and move it where it needs to go. It also helps the tissue not become so hard and tender, which can cause pain. My third method is to increase your hydration. It's all about the water, and when we drink water, we thin out that lymphatic fluid, helping it move throughout our body so it doesn't get stuck, especially in our legs. That's a long way for the lymphatic fluid to move, to go all the way up to our heart. And so by drinking water, we thin that fluid out so it can move easier, it can get through the lipedema tissue easier, and overall help your body function at its best. So these are not going to heal you from lipedema, unfortunately, but they should help you feel better. Again, a huge take-home point for me is that these rules are not 100%. I believe in quality of life, balancing your life, and sometimes when we tell ourselves we can never have sugar again, that doesn't really set well with our mental health. And so knowing that it's okay to have a little bit of sugar, but really try to decrease it. A lot of times people will say the 80-20 rule. So 80% of your diet is very clean, whole foods. 20%, maybe, we have a little bit of fun and kind of adventure out of the whole food categories. But, when we talk about lipedema and really wanting to decrease inflammation, you may say, I feel better when I'm more of a 90 to a 10% rule. So 10% of your time you enjoy gluten, dairy, whatever your body or your mind tends to crave. But 90% of the time you're eating those whole foods. Again, going back to the exercise, it does not have to be in a gym. It could be something as easy as walking. I consider a vibration plate a form of exercise, so standing on your vibration plate if you have one, 5 to 15 minutes, if you build up a tolerance to that, that would be a great example. And lastly, water. It's all about the water to help our body function properly and move that lymphatic fluid through our body.